I'm really excited about the digital medicine program because it really gives me a lot of the data that I ask for. So I'm really a lot more confident of how healthy is this patient, how well controlled are they? And I can really lower their risk. I really like the features, and it's really just getting better and better. I've seen patients a lot more engaged with their health. When they eat something or they do some kind of change with their lifestyle and they see the numbers, they kind of get shocked and they're like, oh, maybe I shouldn't eat that thing or have that salty snack, or maybe I should exercise more because their blood pressure lowers. And so it's really, I think, a reward mechanism because you really see the results that you do real time. So you get a blood pressure cuff from Ochsner, and when you take a reading, it uploads through your phone into your chart. And so your provider sees it that same day, along with your healthcare team, and it's really seamless. And based on that reading, they can outreach to you either through messaging or calling you. So it really is a beautiful way to monitor your patient's health. My dad is a physician, and when I graduated medical school, he gave me a black doctor's bag. The one where when physicians used to go into the patient's home, with their stethoscope and their supplies, and they would see the patient right there. And there was that transition when we could go back to the patient's home, just like the black bag. And it really kind of gives a personal touch because we're meeting the patient where they are. And we want to make it as easy and flexible as possible because we know life happens. And sometimes it's expensive to get a ride or take off work. And patients really do love it. And it's very efficient and very, very easy for the patient, I would say. Really, we've found that everyone wants to be healthy, and they're the CEO of their health. They're the boss, and we're just here to help guide and help try to save them years to spend with their grandkids or their family members. We're trying to keep you out of the hospital. And so that's what brings joy to us and, to the patients. That's why we really do this. It's really to find that connection, which is really what the digital program is.